So this time, let's talk about institutional long-term care. So we're done talking about community-based long-term care services. This time, we're going to talk about institutional ones. And this long-term care services are often based out of physical places such as brick and mortar, and they are either residences or even inpatient care facilities. And they are meant for patients, they're appropriate for patients whose needs can no longer be adequately met in community-based settings, meaning there's probably some level of some clinical care, some level of professional care, people that are certified in some stuff, in some specialties. And even though that may be so, institutional options actually vary, and they try to meet the needs of long-term care clients in a continuum, because the needs of the elderly or those people requiring long-term care can vary. And therefore, the level of assistance is along a continuum, pretty much, from less to more. Retirement facilities is one perfect example. That's the lowest level, wherein there's still a lot of level of independence among the clients. And in retirement facilities, there is no nursing care provided. That means nursing care is not needed. The emphasis is on privacy, security, lots of independence, and very active lifestyles. And retirement facilities are meant for people who can live independently in a physically and socially supportive environment. Now, the next level up is what we call personal care facilities. These facilities focus on custodial care, so basically providing basic assistance in a protected and secure environment, and it does not include active medical or rehab treatments. Next would be assisted living facilities. Assisted living facilities are those institutions that provide personal care, 24-hour supervision, so it's a step up. Also, there would be social activities, recreational activities, maybe some nursing and rehab services. Advanced nursing care and rehab therapies can be arranged through a home health agency, but this is basically done on an intermittent basis and on as needed basis, because this is still a step lower than a skilled nursing facility. So assisted living facilities sort of border between personal care homes and nursing homes. Skilled nursing facilities, or SNFs, are those that are the most familiar and popular among us, I guess, if you could call it that way. So usually institutional long-term care is associated with nursing homes, and this is basically what it is. So a typical nursing home provides a full array of skilled nursing care, also rehab and assistance with activities of daily living. That means people that are admitted in nursing homes already have intermediate to high scores, intermediate to low scores. The lower the score in the ADLs, the more need for a skilled nursing facility services. So there is the presence of skilled nursing care, which is medically oriented, and it's provided by a licensed nurse. The plan of treatment is important. It is actually required, and it needs to be authorized by a physician, and therefore there needs to be a physician that constantly visits the skilled nursing facility. As a matter of fact, a skilled nursing facility needs to have a medical director, albeit the medical director doesn't have to be there all the time, and usually it is a nurse practitioner that runs the whole facility. However, the plan of treatment is authorized and signed off by a physician. And paraprofessionals deliver most of the direct care under the supervision of these licensed nurses or the licensed therapists. Now, some nursing homes will have very intensive medical nursing and clinically complex services, um, within their services. And usually this could also be for people that have been hospitalized and require intensive rehab, perhaps. Um, but not all nursing homes have this type of services readily available. Next would be specialized care facilities, and there is a high emphasis in this cases. There's a high emphasis on medical and nursing services, and specialized care basically specializes on particular conditions. So, for instance, ventilator care for Alzheimer's, for wound care, for intensive rehab, closed head trauma for people living with AIDS. Um, and these are all provided by specially trained and certified professionals. Now let's talk about the licensing and certification needs of nursing homes. Now, nursing homes, just like hospitals, are heavily regulated through licensure and certification requirements. And the licensing basically comes from the state, and the annual renewal of a license is required for existing nursing homes. And the license allows a facility to operate and to do business. And certification, on the other hand, allows nursing home to admit specific patients who are on public assistance. So let's talk a little bit about licensing. So a license to operate a facility is always issued by the state, as we've talked about previously. And the standards could vary from state to state, but again, the rule of thumb of whichever is more stringent is always, whether it's a state or a federal guideline or a local city code, whatever is more stringent is always the one that's being followed. And in order for a nursing home to operate and have a license, they must comply with the specific standards set forth by the state. And a state's department or board or division or the health department of the state or human services generally has the nursing home licensing and oversight responsibilities. Life Safety Code is a national standard, and it's actually on a federal level, and it includes national building and fire safety rules. So fire safety, egress, emergency exits, things like that, and how how the building is designed. Now, the last one that we will be discussing is certification. So certification is issued by the Centers for Medicare and Medicaid Services, otherwise known as CMS. And these certifications basically authorizes the facility to serve Medicare and or Medicare patients. And it is based on compliance with federal standards. In case a facility is not certified by CMS, it can only admit private pay patients. Therefore, those who are in public assistance, those who are in Medicare, and Medicaid, they cannot admit those patients if those public programs are the ones responsible as a third-party payer source. Now, there are 3 different certification categories, and they are all federal certification. The first is SNF, Skilled Nursing Facility Certification, and it's for Medicare coverage after hospitalization for at least 3 days. Now remember, Medicare does not cover long-term care. It does cover a few days, and in this case, usually around 3 days. Now, NF, for Nursing Facility Certification, is for Medicaid. So these are for patients who are on Medicaid as their third-party payer source. And most facilities, what they do is they have dual SNF and NF certification, so that when the reimbursements from Medicare expires, if the patient is dually qualified, then the certification the NF certification allows them to bill Medicaid. The next certification is called ICF-MR or ICF-IID. Basically, it stands for Intermediate Care Facilities for the Mentally Retarded or developmental disability. So these are for clients who mostly qualify for Medicaid. For specific patients that receive Medicaid and are qualified because of this certain developmental disabilities, nursing homes can only admit them if they have this type of certification. After this learning video, so this is learning video number 4, there is a resource video which basically showcases a skilled nursing facility. It calls itself a hospital, but really it's a skilled nursing facility. So I want you guys to watch that resource video immediately after this lecture video for you to have an idea how a nursing home operates.